Joining us on Smartlife to tell us everything we need to know about bad breath is Dr. Jorge Blanco, a general and cosmetic dentist at Images Dentistry. Thank you for joining us today at Smartlife, Doctor. Appreciate it.
My pleasure.
All right, so you know what's hilarious about this? I mean, before we started this, you know who gave me a tic-tac? My husband on TV, okay?
Not that
he gives me a tic-tac, and I go, why? And he goes, no, I just wanted to offer you one. And I'm thinking, you know, but people do that.
You didn't need it.
But I didn't. I don't.
What?
I don't think so. But stop.
Yeah.
But you know, that happens to a lot of people, right? They'll say, hey, would you like a minute? And you're like, oh my gosh, are you trying to tell me something? So
you get self-conscious, right?
You really do it. People get self-conscious when it comes to bad breath, known as halitosis in Spanish.
Halitosis.
Halitosis. So it causes embarrassment. A lot of people get self-conscious, doctor, and the first thing they think of is, oh my gosh, is this a chronic problem, right?
Yes.
Is it?
Nobody wants to tell them. Everybody is embarrassed to say you have bad breath.
Okay.
That's the worst part. But yes, it can be a chronic problem. To some people, the chronic halitosis is something that can be around for years until they find out they actually have it. And so the most important thing is somebody with you, your spouse, your friend, just be honest. Be honest
Why are you
with them.
looking at me? Why are you looking at me like that?
Seriously, that mint, you should have had that mint. Dr. Blanco, so a lot of people think if they brush their teeth, it kind of takes care of everything. It's not as simple as brushing your teeth and that's it, right? I'm sure that's just one of the ways to get rid of it, or?
Yeah, and that's a great starting point. The most common reason for halitosis is gum disease, followed by leaving plaque and food particles in your teeth. So yes, brushing your teeth, flossing are very important to get rid of most of the occurrences of halitosis.
I mean, some no-brainers are, for example, the first thing that comes to my mind is smoking. Please, I mean, just that's enough. When you get sick and you have a cold, you kind of know, like, you're all full of, boogers and everything, and
sinus infection.
Sinus infection. Those are reasons, but there are some people that are literally like born with this, right? And it's a problem.
And it is. Here's the thing with that is that the chronic halitosis, it all comes from a bacteria that produces sulfur compounds. These sulfur compounds are what gives the peste.
La peste.
Right?
Which, let's translate, which is the smell. Nasty smell.
So that can come from bacteria that are either in plaque or gum disease, okay? The other is bacteria that are in the airways. So for example, if you have chronic infections of your tonsils, the tonsils infected produced bacteria produced the odors. If you have the little tonsil stones, a lot of people have them, and a lot of people get bad breath because of them. So you've got to find out where it's originating from. People with sinusitis, chronic sinusitis, they have bacteria that are feeding on that mucus.
So there's a lot of reasons.
A lot of reasons.
So if somebody's taking medication for those problems, isn't medication maybe causes also the halitosis?
That's a great point. So there's a lot of medicines that will cause dry mouth. In dry mouth, lack of saliva is something that'll contribute to the halitosis.
Okay, so is there a way that we can help everybody out there stop looking at me? And
I know where you're going with this. I know where you're going with this.
Is there something we can do to see if we have it? Like, does this work?
That helps, yeah. You can breathe into a bag.
Oh, breathe into a bag.
Breathe it back. Don't breathe too long. You pass out.
Well, that's true. That's another good way.
Yeah.
All right. And when do you go to the doctor? When do you say, okay, I have a problem?
Yes.
Well, first of all, you should be going to the dentist at least twice a year for your cleanings. Okay. So hopefully if you are the dentist, you can bring it up to the dentist if you know that it's a problem, or if your spouse or partner has said something about it. Okay. But definitely, as part of your regular checkup, you should find out if you have active gum disease, things like that.
Okay.
I've seen in the drugstore sometimes in the dental care section, toothpaste, floss. I've seen tongue scrapers. What is that about? I mean, does that have to? Yeah, you scrape your tongue.
Yeah. Okay. So we bathe every day, right? Or I hope.
Yeah, of course.
Okay. So when we bathe,
sometimes even twice a day.
Yes.
Thank you.
When we bathe, we take out the dead skin cells.
Okay.
Right. Our tongues produce skin cells that die, but if you don't brush them off, they're going to accumulate bacteria in there. So the reason for the tongue scraper, or using the toothbrush and scraping your tongue, is to get those dead cells off the tongue, and therefore getting rid of that bacteria that produces the halitosis. So that's another very common reason for the halitosis, is that bacteria lodging on the tongue. So the tongue scraper is a great way to get it out.
Okay, so how do you diagnose it? Someone comes in and says, doctor, everybody's telling me that I have bad. What do you do? Olga, breathe on me? What do you do?
Yeah, we'll start with a very fine periodontal examination or gum exam to see if there's active gum disease. If there is, you can see it right there. You can smell it right there a lot of times.
All right.
I've walked into an elevator before where I've smelled in the environment. It's there.
Sure.
So that's the first thing. The second thing is start looking, when we do our oral exams, we do a posterior throat exam. And if you see the little white spots on the tonsils, you'll bring it up to the patient's attention.
Okay.
How do you clean that out? How do you maintain yourself? Is this something that you've noticed in the past? Oh yeah, I get that, and it comes out and it's disgusting.
Correct. Is there any kind of special toothpaste or special mouthwash? 'Cause I know a lot of mouthwash is just to mask the smell. Is there something that actually kills the bacteria that you're talking
There's
about?
those powerful sprays that kind of leave you like blinded,
Right, but I'm sure there's something else, maybe like chlorine or chloride or something?
Yeah, there is a type of mouth rinse that blocks or absorbs the sulfur compounds. And they're available out there. It helps, but you really need to go to the source.
I see.
If the source is a throat infection, if the source is the tonsil stones, if the source is gum disease, you need to go to the source. One other area that's very important is a medical problem. So for example, somebody with diabetes may have either a sweet smell on their breath. Somebody with liver disease can have a sweet but pungent smell to them.
Look at that.
Somebody with kidney disease may have a fishy smell on their breath.
Wow.
So if you've eliminated all the possible causes and there's something that's suspicious, now we pick up on this sometimes because we're that close to our patients. If you're that close and you pick it up, you'll talk to them about, let's get a medical consultation here.
What about some home remedies? I love hearing these home remedies that Cubans sometimes do, or
DIY.
Hispanics.
Yeah.
Chicken soup.
A la abuelita.
That's all about pollo.
That's something else. That's the cold.
Arroz con pollo.
That's the cold.
Yeah.
But any home remedies?
The best.
I've heard of vinegar.
You can do the white vinegar, that works well. But really, again, it's the home care, the hygiene. A lot of people are quick to skip on the hygiene. Floss, brush, those are the important
things.
Brush your tongue.
Great.
Those are the most important things.
Great.
And why
Awesome.
don't you prove to everybody that you really gave me a tic-tac? Go, look in your pocket. Show them. Give me the
They're
tic-tac.
empty. It's empty. Oh, yeah, hold on one second.
Look.
It's somewhere
The
in here.
show is about to start, and he says, "Do you want a tic-tac?" I don't lie.
It's here. It's
Yeah,
here
here we go. Watch. Here.
It comes.
On the count of three.
Wait.
2. I'm putting him on the spot. This is going to take a little longer, but I'm going to prove my point here.
Not that she needs
There
it,
it is.
people.
Here, look at the tic tac.
You have
He
to
really
be
offered
prepared.
it to me.
A man is always prepared.
Any last
With
minute
the
thoughts for
camera.
our viewers?
Go see your dentist. Spouses, be very vigilant. Tell your spouses or your partners or your friends, hey, there's something going on here. You should look into it.
Be
Dr.
honest.
Blanco, yeah, thank you for your honesty. Thanks for all the advice. You don't need it. You don't need it, baby.
Thanks for the tic tac.
Thanks for being on Smart Life. I'm sure a lot of people learn a lot of things, and we'll hope to see you again.
Definitely. Thank you.
Thank you.